Hello dear, this is Achilles drill where nailing success gets simplified. Welcome to my lecture today where I will take you through the osteology of the lower limb. In the course of this lecture, we will talk about the regions of the lower limb and then we'll talk about the bones in each of these regions. It's going to be a beautiful session. You just have to stick with me to the very end. Let's get straight to work. So now when you talk about the lower limb, we'll start first with the regions of the lower limb. Okay, now the regions of the lower limb are specifically divided into four parts. We have the gluteal region, we have the thigh, we have the leg, and then we have the foot. Now I want you to focus on the picture right here. Of course, this is the lower limb, although right here what we have is the anterior view of the lower limb. We're looking at the lower limb from in front, while right here we're looking at it from the back. Now I want you to understand that this first region right here called the gluteal region is the region around the buttocks. Okay, we can only see it posteriorly. It is more posteriorly defined. Okay, that's the gluteal region right there. However, the thigh, everyone knows what the thigh is. The thigh is that region from the level of the hip joint to the knee joint. We have the thigh right there. Okay, and of course the thigh too is somewhere right here from here to the level of the knee joint. Then we have the leg. A layman calls everything the leg, but in real sense, anatomically, the leg is just from the level of the knee joint to the ankle. So everything we're having right here is the leg. Okay, so from right here to this point we have the leg, and then lastly we have the foot. The foot is definitely from the ankle down to the toes, and all the foot is right there. So each of these regions, they have their own bones, and we'll talk about those in the course of this lecture. All right, so now moving on to our next slide. Now we have the bones properly defined in this picture. Starting with the proximal parts, we have the hip bone right here. Here is one hip bone on the left. We have another hip bone right here on the right. So in real sense, we have two hip bones up there. And now I want you to understand that each of these hip bone is actually a composite of three different bones. We have the ILIUM, we have the ISCHIUM, and then we have the pubis. Okay, three bones making up one hip bone. Okay, I think I have a very nice picture showing that. Are you seeing the various parts of the hip bone right here? We have the ILIUM, of course, which is the largest of the three parts. We have this green one right here, which is the ischium. The ischium is right there. And then we have the smaller one, which is the pubis. The pubis is the smaller one right there. So three bones making up the hip bone. Note that, okay? Going back to that slide again, that's that about the hip bone. Now let's talk about the femur. The femur is the bone of the thigh. The femur is this long bone right here, the longest bone in the lower limb, as a matter of fact. That's the femur. And then we have the patella. The patella is this very small bone right here. Okay, let me get a better pen. Okay, red. The patella is this small bone. It is a sesamoid bone. Okay, within tendons. I will get there, right? So that's the patella right there. Then in the leg, don't forget this region right here is the leg. From the level of the knee to the ankle, we have two bones. We have the tibia and then we have the fibula. The tibia is the largest, is the larger one of the two leg bones. Tibia is the larger one, and it is also the medial one. Okay, so the one close to the midline, the medial bone right there. And then coming down to the level of the foot, in the foot we have the tarsals, the metatarsals, and the phalanges. Okay, I think I have a better picture defining all those. Just understand right here we have the tarsals, which include 7 small bones. The metatarsals, we have 5 of them. The phalanges, we have a number of them. Let me use this proper picture. Okay, so right here, of course, we are seeing the distal end of the tibia and fibula, and then they are articulating with the tarsal bones. This one tarsal bone right here. Here is another one. Here is another one. Just understand that we have 7 tarsal bones, 7 of them. Okay, and then coming down to the metatarsals. The metatarsals include this one right here, this one right here, this one right here. We have 5 of them. There are 5 metatarsals. Okay, 5 metatarsals. And then the phalanges are simply the bones of the toes, the bones in the toes. Okay, so understand that the big toe has just 2 phalanges, in the big toe. However, the lateral 4 toes, the ones right here, maybe the middle toe, the longest one, each of those toes right there have 3 phalanges in each. Okay, each has 3 phalanges, but the big toe has 2. So if we are to count everything together, so we'll be having 3 here, 3 here, 3 here, and 3 here. That's 12. Then 12 plus 2, we'll be having 14 phalanges all together. So I want you to take note of this number: 14 phalanges, and then 5 metatarsals, and then 7 tarsals. Okay, so I now want us to count the bones of the lower limb. Here is a picture just showing the various bones of the foot, the tarsals, the metatarsals, and the phalanges. Okay, now let's count the number of the bones in the lower limb. Okay, the first one right here is the hip bone. We already explained that the hip bone has 3 bones in it. Okay, we have the ilium, the ischium, and then the pubis. 3 bones making up the hip bone. We have the femur, that's 1 bone right there. We have the patella, this sesamoid bone, that's another 1 bone right there. The tibia and the fibula, that's 2 bones. And then we have the tarsals. How many tarsals? There are 7 tarsals. Okay, we'll get there in the course of this lecture. And then there are 5 metatarsals, and then we already established that we have 14 phalanges altogether. 14 phalanges. So can we count all together? I'm sure this will give you 33 bones altogether. So we have 33 bones in each lower limb. 3 plus 1, 4 plus 1, 5 plus 2, 7, 7 plus 7, 14, 14 plus 5, 19, plus 14 should be equal to 33. Okay, so we have 33 bones in the lower limb. So now let's move on in the course of this lecture. Okay, now let's talk about the girdle and the free limb. Now you have to understand that in each limb, be it the upper limb or even the lower limb, there is always a girdle, also otherwise called the basal segment, and then there is always the free limb. You have to understand that the girdle is simply that part of the limb involved in joining the entire limb to the axial skeleton. Now let me walk you through this. Understand that there are, in the human skeleton, we have axial skeleton and then appendicular skeleton. The axial skeleton involves the bones in the axis of the body. You talk about the skull. Every bone in blue right here, every bone in blue right here are the bones of the axial skeleton, the skull, the vertebral column, the ribs, and all. They are bones in the axis of the body. Now the bones of the limb are the ones in white right there. For example, we have the upper limb here, then we have the lower limb here. So I want to draw your attention to the girdle, the basal segment in each of these limbs, and that's the part I painted red right here. This is the hip bone, otherwise called the pelvic girdle in the lower limb. In the case of the upper limb, the girdle is the clavicle and the scapula. So those are the pectoral girdle, the part of the entire limb joining, the part of the limb joining it to the axial skeleton. Okay, so we'll talk about this pelvic girdle in details now. The pelvic girdle, otherwise called the hip bone. Okay, so now understand that the hip bone, of course, there are 2 of them. We have the left, we have the left right here, and then the right here. 2 hip bones. This one on this side, and then there's another one on this side. Please understand that this bone in the midline right here, this yellow bone together with the blue bone right there, they are not part of the hip bone. In real sense, these are bones in the axial skeleton, the sacrum and the coccyx right there. They are bones belonging to the axial skeleton. So in real sense, what I want you to focus on is this hip bone right here, this one in red, and then this other one in red. Okay, so now each bone, as we've discussed when we're counting the number of bones in each lower limb, we established that we have the ilium, the ischium, and then the pubis. Okay, so we'll talk about each of these parts now in details. Okay, stick with me. There's the picture showing the various parts of the hip bone, and then let's talk about them one by one, starting with the ilium. The ilium, of course, is the largest part of the 3 hip bones. Okay, the ilium is the largest, and it has numerous structures on it, and they are very, very important for attachment of muscles, for attachment of ligaments and all. Okay, so starting first with these very prominent and well defined parts, that's the ala, the wing, otherwise called the ala of the ilium. Okay, is right there. A number of muscles together with ligaments, they're attaching to that region. Okay, so we'll talk about those. Understand that the ala, otherwise called the wing, it has this defined iliac crest right there. There is an iliac crest just most superior on the wing of the ilium, and it is very important for attachment of muscles, specifically the abdominal muscles. A number of them attach on this iliac crest. I have a picture of that. Okay, so here is a picture showing some important abdominal muscles inserting or probably taking origin. For example, the external oblique muscle, it has been with there is a cut street right there, but in recent this muscle continues downward and inserts on the iliac crest, while we have the internal oblique muscle right here. Here are the internal oblique muscle. They are taking origin from the iliac crest. So that region is that part of the ilium is very important, the iliac crest. Okay, so now let's talk about other things. There is also the iliac fossa located on the anterior surface of the wing or the ala. Okay, so although we're not seeing the anterior surface right there, this is a picture showing the hip bone from the side, a lateral view. Okay, however, if we flip that picture, we will see the interior part of the ilium, and here is the iliac fossa right there. It is located interiorly. Okay, and I also have a better picture. This picture right here is still showing the iliac fossa, this region inside. Okay, so that's a very important shallow fossa for muscle origin as well. The iliacus muscle, this muscle right here, it takes origin from the iliac fossa. Okay, so that's that about that. Also on the posterior surface of this ala. Okay, don't forget right here, so far we've talked about the iliac crest, we've explained the iliac fossa located on the interior or the anterior surface of the ala. However, the posterior surface is modified with some important prominences, otherwise called lines, and they are for attachment of the gluteal muscles. Okay, I have a better picture of those. So right here, I don't know, are you seeing this line right here on the posterior surface of the wing of the ilium? There is one line called the inferior gluteal line, and then right here we have another one, the anterior gluteal line. We even have the posterior gluteal line right there. These lines are for muscle attachment. You can see a number of the gluteal muscles attaching to those gluteal lines. Okay, so for example, the inferior gluteal line like there is for the attachment of the gluteus minimus muscle, and then the gluteus medius, gluteus maximus, they are all taking origin from those lines. Okay, so now let's move on and talk about other things in the ilium bone. Okay, so now I want to talk about some spines around the ilium. Okay, there are four important ones I will draw your attention to. We have the anterior superior iliac spine. Okay, anterior superior iliac spine. Okay, that's this structure right here, anterior superior iliac spine. We even have an anterior inferior iliac spine. That's this structure right here. It is in front, that is anteriorly, but beneath, inferior. Okay, and then we have this posterior superior iliac spine. There is this one right here, posterior superior iliac spine, and lastly the posterior inferior iliac spine is also right there. Okay, so we'll talk about each of them one by one, and then we'll say one or two things about it. The anterior superior iliac spine is a very important part in the anatomy of the pelvis, the lower limb as well. A number of muscles take origin from that point. Even the inguinal ligament, it also has attachments to the anterior superior iliac spine. I think I have a picture of those. Starting with the inguinal ligament, this structure right here in red is the inguinal ligament. It is coming all the way from the axis, okay, anterior superior iliac spine, and then it is attaching to the pubic tubercle right here. We'll talk about those. And even the sartorius muscle, which is the longest muscle in the body, it has its origin, its proximal attachment. It has it with the anterior superior iliac spine. So right here we can see the inguinal ligament, the one in white, and then we have the sartorius muscle right here, the longest muscle, coming all the way from the axis as well. Okay, so that's that about that. Let's talk about the anterior inferior iliac spine now. That's the one down here, anterior inferior iliac spine. Just understand that the rectus femoris muscle, this muscle right here, it has its origin from the anterior inferior iliac spine, rectus femoris muscle, which is a part of the quadricep muscle. Okay, so note that. And then when you talk about the posterior superior iliac spine together with the posterior inferior iliac spine, they are all for attachment of ligaments. These two right here, they are for attachment of ligaments. I have a picture of those. Okay, specifically the posterior sacroiliac ligaments joining the sacrum to the ilium. They are right here. Okay, posterior sacroiliac ligaments. So they attach to the posterior superior iliac spine as well as the posterior inferior iliac spine right there. Okay, so we'll move on and talk about the ischium bone now. The ischium is the intermediate of the three hip bones. It's not the largest, neither is it the smallest of the three hip bones. It's just somewhere right there in the middle. Okay, this bone right here in lilac, that's the ischium bone. Okay, everything right here is the ischium bone. So and there are some important structures on it too: the ischial spine, the north sciatic notches, ischial tuberosity, and the ischial ramus. These structures are important for muscle and ligament attachments. So we'll talk about those structures now, starting first with the ischial spine. The ischial spine is this structure, this tubercle right there. Okay, and it is very important. It is kind of a landmark for some notches around the hip. Okay, we have the greater sciatic notch right here, more or less like an indentation, and then we have the lesser sciatic notch somewhere right there beneath the ischial spine. Okay, so the ischial spine, the one in red, somewhere in the middle. Above it we have the greater sciatic notch, beneath it we have the lesser sciatic notch. Okay, and then you have to understand that this ischial spine still functions for an attachment point for ligaments, especially the sacrospinous ligament. The sacrospinous ligament attaches to the ischial spine, and then we have this ischial tuberosity, this roughened part. This roughened part right there is a very important structure for ligament attachment, and also the attachment, but the proximal attachment point for the hamstring muscles. Okay, so I have a picture showing those, starting first with the spine. The spine is right here, somewhere around this place, and you can see the sacrospinous ligament attaching to it. Okay, so that's the spine for you, and then the ischial tuberosity is somewhere here, and you can see the sacrotuberous ligament. This ligament right here, sacrotuberous ligament, is already attaching to the ischial tuberosity. So those points, they are there. Those structures are important. They are important for muscle and even ligament attachment. For example, the sacrotuberous ligament, the hamstring muscles, talk about semitendinosus and then semimembranosus, bicep femur. There will still be a proper class for the muscles of the lower limb. So I just want you to take note of the bony structures. You can see the ischial tuberosity is somewhere here. You can see these important muscles having attachments to the ischial tuberosity. Okay, so they are important structures. For example, if there is a fracture to the ischial tuberosity or an avulsion, then you will expect that these various muscles will be affected. You will expect that the sacrotuberous ligament will be affected. So that's that about that. Now, lastly, we have this important ischial ramus. Ischial ramus. When you hear the word ramus in anatomy, ramus is simply an extension from the body. So we have the ischial ramus right there, which is an extension from the ischial bone. We even have this pubic ramus. The pubic ramus is this structure, inferior pubic ramus. So we'll get there when we get to the anatomy of the pubis. So the ischial ramus together with the inferior pubic ramus, they give rise to a structure called the ischiopubic ramus. Okay, the ischial ramus together with the inferior ramus of the pubis giving rise to ischiopubic ramus, and the composite structure function for proximal attachment of some important muscles, the adductors of the hip joints. Okay, so here are some of those muscles. Okay, some of them are right there having attachment to the ischiopubic ramus, which is formed by the pubis and the ischium. Okay, so that's that about that. Lastly, now let's talk about some other things in the hip bone. We have the obturator foramen right here, a very important foramen, although it is occluded in real life with the obturator membrane. We also have this structure, this fossa right here. This is the acetabulum, which is where the head of the femur attaches to. Okay, so the obturator foramen first, it is occluded with the obturator membrane. You can see the obturator membrane right there, and then we have the acetabulum right here. The acetabulum is for the head of the femur. Okay, so that's that about that. Let me say one thing about the pubis before I move on. We've explained the inferior pubic ramus, which joins with the ischial ramus to form the ischiopubic ramus. Now there is also a superior pubic ramus, and that's this extension upward. This upward extension right here is the superior pubic ramus. And lastly, we have the pubic tubercle. We've mentioned that today. The pubic tubercle is for the attachment points of the inguinal ligament. Okay, we already explained that the inguinal ligament comes all the way from the axis, anterior superior iliac spine, and then it goes down to the pubic tubercle right there. It attaches to the pubic tubercle medially. All right, so that's that about that. Here's a picture of the acetabulum. The head of the femur attaches to it ideally. Okay, so we'll move on and talk about the femur now. The femur, of course, is the bone of the thigh, and aside that, it is the longest bone in the human body. It's by far the longest bone. It is also the longest bone in the lower limb, of course. In the upper limb, the longest bone is the humerus. Okay, now it is also a long bone. You know, in anatomy we have short bones, we have long bones, sesamoid bones, and so on and so forth. But the femur is a long bone, and then it proximally articulates with the acetabulum, as we discussed in the previous slide, and then distally it articulates with the tibia to form the knee joint. Okay, so that's the femur for you. And here is a picture showing the anterior surface, anterior view of the femur. We're looking at the femur from in front right here. The proximal part, everything right here is the proximal part, the shaft, and then the distal part. And here is a picture showing the posterior view of the femur. So we'll talk about the proximal femur and then the distal part of the femur individually now. Okay, in the proximal part of the femur, there are some important structures around it. There is this very prominent head, the head of the femur, and then there is the neck of the femur. There is even some trochanters. There is the greater trochanter, the lesser trochanter, and many other structures. We'll discuss each of them. Okay, so now starting with the head, I want you to take note of a structure on the head of the femur. There is a depression, there is a fossa located in the head of the femur. That fossa is called the fovea capitis. I have a better picture of that. So are you seeing this fossa on the head of the femur? That fossa is called the fovea capitis, and that's where the ligamentum teres, a very important ligamentum teres, that's where it attaches to. It attaches to the fovea capitis and then joins into the acetabulum. The previous picture shows that. Are you seeing the ligamentum teres here? Okay, it's attaching to the fovea capitis somewhere here, and then the ligamentum teres does join to the acetabulum. Okay, so that's that about that. Now let's talk about the neck of the femur. The neck of the femur, of course, it connects the head to the shaft, to the remaining part of the femur, and it also helps to transfer weight from the body to the femur. So the neck is also one important structure. Here is a picture showing some important clinical correlations associated with the neck of the femur. You have to understand that the neck of the femur, there is an angle right there. There is an angle with which it joins with the shaft of the femur. That angle is normally between the range of 120 to 135 degrees. If it is lesser than this range, there is a clinical condition called cosa vara, and then if it is greater than that, called cosa vaga. Okay, we want the ideal range 120 to 135. That's the normal range. Okay, so the neck of the femur is that important. And then we have some trochanters around the proximal part of the femur. We have the greater trochanter and then the lesser trochanter. Okay, so this important projection upward, here is the greater trochanter, while this one downwards right here, that's the lesser trochanter. Okay, so we'll talk about them one by one, starting with the greater trochanter. The greater trochanter is a very important point, is an insertion point for the hip abductors. Okay, the hip abductors insert onto the greater trochanter. Okay, the piriformis muscle too as well inserts to the greater trochanter. Okay, and here are the hip abductors. We have gluteus medius, we also have gluteus minimus. Those are some of the important hip abductors inserting to the greater trochanter. And to start with, what is abduction? Abduction is simply taking away a limb from the midline. Okay, I think I have a GIF of that. So take a look at this GIF. So this is showing the movement abduction. Abduction means taking away a limb from the midline. Abduction. Okay, so the reverse movement is adduction, but for now I want you to focus on abduction. Okay, so gluteus minimus, medius, they are important abductors of the hip joint, and they insert to the greater trochanter. So imagine a fracture of the greater trochanter. It means movements like abduction will be very difficult. Okay, so that's that about that. So and then I told you the reverse movement adduction. It means bringing a limb towards the midline. Take a look at this. This movement, bringing a limb back to the midline, is called adduction. Adding, bringing something back to the midline. Okay, so that's that about that. So we'll talk about the lesser trochanter now. The lesser trochanter, of course, that's the smaller one right here. One bone somewhere right there. Here is the greater trochanter. We've explained it already. Lesser trochanter is right here, and it's a very important insertion point for the hip flexors. Talk about the iliacus muscle, psoas major. They insert to the lesser trochanter right there. Okay, so the two muscles, iliacus and psoas major, they carry out flexion of the hip joint, and it involves bringing the hip joint, the femur, it involves bringing it forward. Okay, take a look at this GIF. I'm showing the flexion movement. You can see iliacus muscle and psoas major, they are contracting right there to bring the femur forward. That movement is called flexion. The insertion point again is what? The lesser trochanter. The muscles are inserting to lesser trochanter, drawing insertion towards origin, brings about the movement flexion. Okay, so now let's talk about other things associated with the proximal femur. We have the intertrochanteric line, which is located anteriorly. There is an important line right here, intertrochanteric line. And then we even have an intertrochanteric crest, which is actually located posteriorly behind. I have a picture of that. So we can see the intertrochanteric line right here in front, but the intertrochanteric crest is behind. Okay, here is the intertrochanteric crest right here. It is behind. we're looking, this is a posterior view. Okay, you can take a look at this intertrochanteric crest, intertrochanteric line in front, where right here we have the intertrochanteric crest located posteriorly. So starting with the intertrochanteric line, the intertrochanteric line serves for the attachment of the iliofemoral ligament, the iliofemoral ligament joining the ilium of the hip bone to the femur, iliofemoral ligament. Okay, so and that's the ligament right here joining the ilium bone to the femur, iliofemoral ligament. So, and then intertrochanteric crest, we already explained it is posterior. It is also is an attachment point for some important external rotators of the hip joint. You talk about the piriformis muscles, superior gemellus, inferior gemellus, and all these muscles. We'll go into details when we get to the anatomy of the gluteal region. So, but for now, understand that they attach to the intertrochanteric crest. Okay, so that's that about that. Then let's move on and talk about the gluteal tuberosity. The gluteal tuberosity is also located on the posterior aspect of the femur. That's this roughened edge right here. It is an important attachment point for the gluteus maximus muscle. Okay, take a look at the gluteus maximus muscle. This muscle right here. The deep fibers, the deep 1/3 fibers of the gluteus maximus, they insert into the gluteal tuberosity, while the remaining fibers joins with the iliotibial tract. We're not interested in that for now, but just understand that the gluteus maximus muscle attaches to the gluteal tuberosity. Okay, so and that's that about that. Finally, we have the linea aspera. The linea aspera is also located on the posterior part of the femur, and it runs down the length of the femur. Look at the linea aspera right there going downward. There is a better picture here. Look at linea aspera from the level of the gluteal tuberosity. Linea aspera is continuing downward. It's a very important attachment point for the adductors of the hip joint. Adductors of the hip joint, they attach to the linea aspera. Even the quadricep muscles as well, specifically the vastus medialis, lateralis, and intermedius, they also have attachment with the linea aspera. Okay, so that's that about that. We're done with the proximal part of the femur. So we've explained the head, we've explained the neck, we've explained the greater trochanter, we've explained the lesser trochanter, the intertrochanteric crest, and we've explained some structures on the shaft of the femur as well. Explain linea aspera, gluteal tuberosity, and all. Okay, so in our next class we'll say more on the distal end of the femur. Talk about the distal end of the femur. We'll also talk about the tibia and fibula, and of course the bones of the foot. So that will be all for now. Thank you very much for tuning into my channel. If you find this video helpful, do it to hit the like button. Let's not forget there is an important quiz I've set for you. Just check the description box. You will see the link to a quiz I've set for you. Once you click on the link, it will refer you straight to Telegram, and then you will see some questions on everything we've discussed so far on the osteology of the lower limb. You can attempt it to consolidate everything you've learned so far on the osteology of the lower limb. Thank you very much.